Let's discuss the 5 elements theory and its application in TCM. The first application is to explain the physiological function of the 5 viscera and their relationships. So to explain this relates to explaining the characteristics of the physiological functions in the 5 viscera. So the 5 element theory classifies the 5 Zhang viscera into 5 elements to explain their physiological functions. For example, the liver prefers to free flow of qi and tends to be free from obstruction. So its characteristic of the physiological function is to smoothen qi dynamically. This is similar to the characteristics of wood of growing and flowering. Therefore, the liver pertains to wood. The rest can be explained in the same order. Second function is to explain the inner relationships among the 5 viscera. Because 5 Zhang viscera are attributed to the 5 elements, not only their physiological functions can be explained by this theory, but also their inner relationships can be explained by the generating and restricting cycles. Generation among the 5 elements may be used to explain the generating relationships among the 5 Zhang viscera. For instance, the liver stores blood to support the heart. Thus, wood generates fire and liver promotes heart, and so on. The restricting relationships among the 5 Zhang viscera can be explained in terms of restriction among the 5 elements. For instance, the transformation and transportation by the spleen may prevent the disorder of kidney, which is water, which is referred to as earth restricting water. The kidney, which pertains to water, is yin, which goes up to prevent the hyperactivity of the heart, which pertains to fire, which is referred to as fire restricting fire, and so on. The third function is change and their mutual influences. Okay, first we discussed there is an abnormal change of generating. The abnormal change of generating cycle means that disease occurs by following the order of generation or against the order of generation. It includes 2 conditions: involvement of the child by its mother and involvement of the mother by its child. The involvement of the child by its mother means that disease occurs following the order of generation. It means that a disorder of a mother element involves or affects its child element, leading to both anomalies from mother to child. Because a mother element is weak, its child element also gets deficient. For example, if a kidney disease affects the liver, a mother disease involves its child. Next, we have the involvement of the mother by its child means that disease occurs against the order of generation. It means that a disorder of a child element involves or affects its mother element, leading to both anomalies from child to mother. For example, if a heart disease affects the liver, a child disease involves its mother. Abnormal change of restriction is over-restriction and counter-restriction. It means that disease occurs following order of restriction or against the order of restriction. For example, if a liver disease affects the spleen, which is called wood of restricting earth, if a liver disease involves the lung, which is called wood counter-restricting metal. So the next function is to guide the clinical diagnosis. The 5 Zhang viscera have certain relationships in the attribution to the 5 elements according to the changes of 5 colors, 5 flavors, 5 emotions, and pulse condition. Therefore, the theory of the 5 elements can be used to diagnose disease. According to its attribution to the 5 elements, the diagnosis can be made according to the laws of generation and restriction. For example, a patient whose complexion is greenish with a preference for sour food and a wiry pulse may be diagnosed as having a liver disease. A patient with spleen deficiency accompanied with a greenish complexion implies that wood pertaining to the liver over-restricts earth pertaining to the spleen with deficiency. The next function is to guide the treatment of disease. To prevent the changes of the disease. So during the disease onset, one Zhang viscera disease may affect other Zhang viscera. Therefore, when treating the pathological viscera, the other related Zhang viscera should also be treated according to the laws of generation, restriction, over-restriction, and counter-restriction. Thus, the changes of disease can be prevented and the recovery can be promoted. Next is to decide the therapeutic principle and method. So the therapeutic principle and method to be decided according to the law of generation. The therapeutic principle decided according to the law of generation include tonifying the mother for deficiency and sedating the child for excess. Tonifying the mother for deficiency. This principle is applied in the deficiency syndrome of both mother and child. For example, if kidney yin gets deficient and fails to nourish the liver wood, it implies that water fails to nourish wood. The therapeutic principle is not only to deal with the liver, but also to nourish kidney yin. Therefore, by nourishing the kidney, yin will nourish liver. Sedating the child for excess. This principle is applied in the excess syndrome of both mother and child. Take, for example, the liver fire that gets too hyperactive. The liver is the mother and the heart is its child. Therefore, sedating heart fire will help to restrict liver fire. Thank you for listening.
Interviewing, long breathing, coughing. Long. Inquiry should be made about the respiration, coughing, whether there are exudations from the nose, and whether is mucus in the chest or in the throat. Breathing difficulties and coughing always indicate that there is a disturbance of lung qi. The disturbance can be due to imbalances in the lung itself or other factors affecting the lung. This is because it is the lung that controls the breathing by sending its qi downwards. Heaviness and tightness in the chest have been described above. Breathing. When a person becomes breathless, it is because the lung is not able to send its qi downwards, or because the kidneys are not able to grasp the qi. Lung qi shu, possibly combined with the spleen qi shu, can manifest with the lung not being strong enough to descend and spread qi from the chest. Lung qi can also be blocked in its movement by xie qi, and this will typically be some form of phlegm. But qi stagnation in the upper jiao may also be involved. Invasions by exogenous xi qi can also block the lung qi. Difficulty breathing can be due to lung qi shu or lung yin shu, resulting in the lung being too weak to descend and disseminate qi. Kidney qi shu can mean that the kidneys are not strong enough to grasp the qi. Phlegm, shu stagnation, or qi stagnation can block the movement of lung qi. Phlegm will often be the cause of wheezing or rattling sound in the chest. A person who frequently yawns or has a need to sigh will often be manifesting liver qi stagnation. The body yawns or sighs in an attempt to fill the lung with air and thereby strengthen zong qi so it can forcibly disperse and circulate the stagnant qi. Coughing. If the person has a cough, It is important to ask about how loud the cough is, how long they have had it, if there is sputum, and the consistency and color of the sputum and when the cough occurs. A powerful, explosive, or barking cough will be seen in a Shih condition, usually heat and or phlegm. If the cough is acute and has recently arisen, it will probably be due to an invasion of exogenous Shih qi. Chronic coughs can be Shu or Shi or a combination of both. Long Qi Shu and Long Yin Shu coughs will be weak and will not be loud. Long Yin Shu will manifest with a cough that is dry, ticklish, and worse in the evening and at night. There may be dry, rubbery sputum that is difficult to expectorate. Both Long Qi Shu and Long Yin Shu coughs will be worse after the person has used their Long Qi, for example, by talking, triggering a coughing fit. They will also cough more frequently when they are tired. Exposure to a dry environment can result in a dry cough. The lung fears dryness because dryness will injure lung yin. Dryness is not normally a climatic influence associated with Northern Europe, but it can be seen when there is poor indoor air quality, such as in buildings made of concrete. Phlegm pattern coughs are usually worst in the morning. This is because the phlegm will have accumulated in the lung during the night whilst the person is lying down. There are several types of phlegm and each will have its own characteristics. Phlegm heat results in a loud, sometimes barking cough with yellowish or greenish sputum. This mucus can be sticky and difficult to expectorate. This is a typical smoker's cough. Damp phlegm and phlegm cold will manifest with thin, watery sputum that is looser. Phlegm fluids manifest with sputum that is very watery. There will be a bubbling, rattling sound in the lung, and the person will have difficulty lying down because they start to suffocate. Coughs with profuse sputum that are worse after consumption of certain foods, such as dairy products, are due to damp phlegm in the lung. The root of this phlegm will often be spleen qi shu with dampness. It is said that phlegm is stored in the lung, but produced in the spleen. If there is an element of qi stagnation, the cough or breathing difficulty will be worse in the morning or when the person is angry, frustrated, stressed, or in the premenstrual phase. Thank you for your attention.
Let's discuss diagnosis according to pathogenic qi, deficient heat. Etiology: yin is weakened by old age, physical, mental, and emotional overexertion, including stress, disease, excessive conditions, too much sex, dietary imbalances, blood loss, and excessive sweating. Symptoms and signs: malar flush, fever, or warm sensation in the body in the evening and at night. Night sweat, sweating or hot sensation in the palms of the hands, soles of the feet, and center of the chest. Dry mouth and throat, thirst with desire to sip water, nervous, fidgety movement, restlessness and unease, slight sensation of anxiety, palpitations, nervous, rapid speech, talks a lot, dark scanty urine. Constipation or dry stool, red tongue with little or no coating, possibly with cracks in the surface, rapid, fine, or possibly superficial pulse. The key symptoms: there is malar flush, evening fever or night sweat, dry mouth and throat, red tongue with little or no coating. For the treatment principle, we have to nourish yin and control heat. The acupuncture points: choose from kidney 2, kidney 3, kidney 6, REN 4, UB23, UB52, spleen 6, and heart 6. Needle technique is tonifying apart from kidney 2, which should be drained. Explanation: kidney 2, kidney 3, kidney 6, REN 4, UB23, UB52 nourished kidney yin, which is the foundation of all yin in the body. Spleen 6 nourishes yin. Heart 6 nourishes heart yin. Relevant advice: when there is deficient heat, the person should avoid food and drinks that have a warming energy, such as alcohol, garlic, and chili. They should also avoid stimulants such as drinks that contain caffeine. Furthermore, they should avoid too many spices in the diet. Stress and overwork will weaken yin. It is important that a person who is yin deficient goes to bed early and gets enough sleep. Deficient heat can be caused by the following pattern of imbalance: excess heat, blood deficiency. Deficient heat can also result in the following pattern of imbalance: internally generated wind. Thank you for your attention.
Diagnosis according to 6 stages. Taiyin stage. The Taiyin stage, this is the first of the Yin stages, and the disease is not life-threatening. If properly treated, the prognosis is good. When Qi cold invades the Taiyin aspect, it will damage the spleen yang. The functions of spleen yang include the transformation of the food and fluids that are ingested. When the spleen yang aspect is compromised, the spleen has difficulty performing its functions. This dysfunction of spleen yang, combined with the presence of damp cold, will result in a blockage of the qi mechanism in the middle jiao. This will characterize a diagnostic picture with symptoms and signs such as a watery diarrhea containing undigested food, watery vomiting, nausea, poor appetite, abdominal bloating, and fatigue. The person will lack thirst due to the accumulation of dampness and stagnant fluids. They will have an aversion to cold, and their skin will feel cold when palpated because they are yang shu. Because it is a yang shu condition, they will be able to get warm if they wear sufficient clothes or lie beneath a blanket. This differentiates the pattern from a Taiyang stage pattern where the person cannot get warm despite wearing warm clothes or lying beneath their thick blankets. Etiology. The Taiyin stage pattern can arise because exogenous qi has directly invaded the interior in a person who is spleen yang shu, or when exogenous qi that has been in the outer aspects penetrates deeper. Qi can penetrate inwards when zheng qi starts to become deficient or exhausted. Taiyin stage patterns can also arise due to medical treatment. This will typically be due to the use of antibiotics, which are cold in their dynamic and can draw the qi inwards and downwards. This pattern can also combine with patterns from the other stages. For example, Taiyang patterns. In these situations, there will be symptoms and signs from both patterns. Symptoms and signs: abdominal bloating, loss of appetite, nausea, watery vomit, watery diarrhea, lack of thirst, cold limbs. The skin feels cold, especially on the abdomen, and pale complexion. The person has difficulty keeping warm. The person is dressed in warm clothing. The person sits with their arms around themselves or lies curled up. There's fatigue. There's pale tongue with moist white coating and a slow, weak, and deep pulse. The key symptoms are watery diarrhea, bloated abdomen, nausea, a pale tongue with white, moist coating. The treatment principle: tonify the spleen yang. Acupuncture points: choose from Ren 8, Ren 12, stomach 36, lung 9, spleen 3, spleen 9, stomach 21, UB20, and UB21. The needling technique should be tonifying on all points except on spleen 9 and stomach 21. Moxa must be used. Explanation. REN 8 with moxa expels cold from the middle jaw. REN 12, stomach 36, spleen 3, UB20 and UB21 tonify spleen yang. Lung 9 tonifies Taiyin. Spleen 9 drains damp cold, and stomach 21 regulates stomach and spleen chi. Relevant advice. The patient should eat foods that are warm, both in their temperature and energetic dynamics. For example, ginger and other spices. They should eat cooked food and avoid food and drinks that are cold in their temperature and energy. They must keep the abdomen warm and avoid getting cold because they are chu. They must get enough rest and not overexert themselves. The Taiyin pattern can be caused by the following patterns of imbalance. Taiyin stage, Yangming stage, spleen yang shu. The Taiyin pattern can also result in the following patterns of imbalance. Shaoyin pattern, Juyin pattern, Shaoyang pattern, spleen yu shu. Thank you for your attention.
Now let's talk about balancing the distal and local points, particularly the distal points. In acute cases, the distal points have the effect of removing obstructions from the channel and expelling pathogenic factors, and they are therefore usually needled with reducing method. The local points have the function of supporting the eliminating action of the distal points and focusing it on the desired area. They are usually needled with even method. For example, in treating an acute sprain of the lower back with bilateral pain on the lower back, one might choose bladder 40 as a distal point, needled with reducing method, and bladder 26 as a local point, needled with even method. Sometimes distal points are needled before inserting the local ones. The example of stomach 38 for acute sprain of the shoulder has already been discussed. In chronic cases, distal and local points simply reinforce each other's function. So we have the next table that will list the main distal and local points according to areas. This will list points from different channels, and the choice of which point to use has to be guided by other factors, chiefly proper identification of the channel involved. Let's start with the face. Local point is in tongue. Distal points would be LI4 and stomach 44. For the temple region, the temple area, we have the Taiyang and GB8. Distal points would be TB3, TB5, and GB43. At the occiput, local point would be GB20, bladder 10. Distal points would be SI3 and bladder 65. At the vertex, we have DU20. Distal point would be liver 3. Eye area, bladder 1, stomach 1 would be the local points. Distal points would be LI4, liver 3, heart 5, SI6, TB3. Nose, we have Intang, Yingxiang, Pitong as local points, then lung 7 and LI4 as distal points. For the teeth, stomach 4, stomach 6, stomach 7, distal points would be LI4, stomach 44. For the ear, we have TB17, SI19, GB2, TB21, and Erman, which is an extra point, as local points. Then distal points would be TB2, TB3, TB5, and GB43. Tongue, REN23, local point. Distal points would be P8, heart 5, kidney 6. Throat area, REN22, local point. Distal would be LI4, lung 11, kidney 6. Lungs, local, lung 1, bladder 13, REN 17, and REN 22. Distal, lung 7, lung 5. Heart area, local would be bladder 15, bladder 14, REN 14, and REN 15. Distal points would be P6, heart 7, P5, P4. Stomach area, local point would be bladder 21 and REN 12. Distal would be P6, stomach 36, and spleen 4. Liver, bladder 18, and liver 14 as local points. liver 3, GB34 as distal points, gallbladder, bladder 19 and GB24 as local points, GB34, danang shui, which is an extra point, as distal points. For the intestines, bladder 25 and stomach 25 as local points, stomach 36, spleen 6, stomach 37, stomach 39 as distal points. For bladder, REN 3, bladder 28, REN 2, bladder 32 as local points. And as distal points, we have spleen 6 and bladder 63. Urethra, REN 2 and bladder 34 as local points, liver 5 and bladder 63 as distal points. And finally, the anus, DO1, bladder 54 and GB30 as local points, and bladder 57 and bladder 58 as distal points. As mentioned, the points in the table are from different channels, and their choice is to be further guided by identification of patterns and channel involved. For example, 2 of the distal points indicated for the throat are lung 11 and kidney 6. Lung 11 would be selected in sore throat from acute invasion of wind heat, while kidney 6 would be chosen for a dry throat from Yin deficiency. As another example, the distal points indicated in the table for the heart are P4, P5, P6, and heart 7. P4 would be chosen if there were an irregular heartbeat. P5 if phlegm were obstructing the heart, P6 in heart deficiency, and heart 7 for heart blood deficiency. Thank you for your attention.
Let's continue with diagnosis according to Zhang Fu organ patterns with the pattern stomach chi stagnation. Stomach chi has a descending dynamic. If stomach chi is disrupted by food stagnation, pathogenic chi, or imbalances in other organs, the stomach will not be able to send its chi downwards. Initially, the stagnation of discomfort and bloating in the abdomen. With time, stomach chi can become rebellious and ascend upwards, with symptoms such as belching, hiccups, or vomiting as a consequence. Stomach chi stagnation has its etiology in eating too quickly or eating while stressed. Because working or eating while stressed or while on the go will stagnate stomach chi. Food, particularly spices, which have an ascendant dynamic, will disrupt the downward dynamic of stomach chi. Liver chi should support the stomach in sending its chi in the correct direction. Stress, irritation, unresolved emotions, anger, and so on can stagnate liver chi. This will initially result in the liver not supporting the descent of stomach chi. Subsequently, liver chi can invade and block the stomach's chi mechanism. Stomach chi stagnation has the following symptoms and signs: discomfort or pain in the stomach or epigastric region, bloating, the upper abdomen can feel tense or bloated on palpation, irritability, hiccups, belching or regurgitation, nausea. The tongue can be a little red or swollen in the middle, and the pulse would be wiry on the right gland position. The key symptoms here are pain or discomfort in the epigastric region, belching, and regurgitation. For treatment principle, we regulate stomach chi. For our acupuncture points, we may choose from stomach 21, stomach 34, stomach 36, REN 11, REN 12, REN 13, REN 22, Sanjiao 6, pericardium 6, and bladder 21. And we can use the draining needle technique. So to further explain the choice of points, stomach 21, stomach 34, stomach 36, REN 11, REN 12, and bladder 21 regulate stomach chi. Pericardium 6 and Sanjiao 6 regulate chi in the middle jiao. REN 13 and REN 22 descends rebellious stomach chi. When there is stomach chi stagnation, it is important that the person eats slowly, doesn't eat too much at a time, and doesn't eat constantly. They should chew their food well and avoid foods that are difficult to transform. If stress and emotional functions, irritations, and anger create liver qi that invades the stomach, the person should try and resolve these issues. It is important that the person does not sit still for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Stroking downwards with the fingers from Ren 16 to Ren 8 will help stomach qi to descend. Stomach qi stagnation can be caused by the following patterns of imbalance: spleen qi deficiency, stomach qi deficiency, stomach yin deficiency, food stagnation, liver qi stagnation. In turn, it can result to the following pattern of imbalance: food stagnation, stomach fire, stomach yin deficiency, phlegm fire, and stomach blood stagnation. To summarize, stomach qi stagnation has its etiology in emotional problems like prolonged stress, anger, frustration, and worry, and poor dietary habits. Underlying and accompanying pathology are stagnation of liver qi, stomach qi ascending counterflow, stomach qi deficiency, and a mild stomach upset. Signs and symptoms are epigastric pain and distension, nausea and vomiting, belching, hiccup, irritability, sleeplessness, abnormal stool. The pulse will be wiry on the right middle position, and the tongue may be red on the sides or central part. For the treatment principle, we harmonize the stomach and middle burner. Of course, the liver transform phlegm and damp and stop pain. For the acupuncture treatment, we can use stomach 34 to harmonize the stomach, stomach 21 to regulate qi and stop pain, stomach 19 to harmonize the middle burner and descend stomach qi, kidney 21 to harmonize stomach qi, spleen 4 and with pericardium 6 to stimulate the descending of stomach qi, GB34 courses the liver qi, REN 12 to supplement stomach and spleen qi, stomach 40 to transform phlegm and dampness, and we needle all with drainage. Thank you for your attention.
Diagnosis according to Qi, Shui, Jinye imbalances. Qi Shu. Qi Shu. Any Zhang organ can be Qi Shu, but when there is a diagnosis of Qi Shu, there will usually be a Shu condition in one or more of the Qi producing organs, the lung, the spleen, and the kidneys. This does not mean that other organs cannot be Qi Shu. Heart Qi Shu is, for example, a very common pattern of imbalance, but in this case, the condition of Qi Shu is related to a specific organ's functioning and it will not necessarily affect the state of Qi and the functioning of the body in general. When there is a diagnosis of Qi Shu, there is a systematic deficiency or lack of Qi, and this is seen in the accompanying symptoms and signs in the whole body. When a specific organ is Qi Shu, there will be symptoms and signs that this organ is unable to perform its functions properly due to a lack of Qi. This condition will though be differentiated as a Zhang-Fu imbalance. A generalized condition of Qi Shu will arise when more Qi is consumed than the body is able to produce. This may be due to overusing and straining Qi, such as when there is illness, overwork, excessive sport and fitness training, excessive physical and mental activity, too much sex, and lack of sleep. Qi Shu will also rise when not enough food has been consumed, or if the food that has been consumed and air that has been inhaled are poor of quality, so that sufficient Qi to replenish the Qi has been consumed is not produced. There can also be a deficiency or weakness of Jing, the inherited essence that is the foundation of Qi. Finally, Qi Shu can be due to weakness of one of the three Qi-producing organs, a kidney Qi Shu, spleen Qi Shu, or lung Qi Shu, or a combination of these. The key symptom of Qi Shu is fatigue, but even though Qi Shu will always result in fatigue, not all fatigue is the result of Qi Shu or a Shu condition at all. The fatigue will manifest both physically and mentally. Apart from the fatigue, the person may have a pale face. This is because there will be too little qi to send shui up to the head. That is why the tongue will also be pale. Fluids will not be transported and transformed as they should be. This will manifest with the tongue being swollen or having teeth marks on the sides. Qi is needed to maintain control of the pores in the skin. Therefore, if there's a lack of qi, there can be spontaneous sweating or perspiration on light activity. A person who is qi shu will often be short of breath and quickly become breathless. This is because the lung is too weak to disseminate qi. Zong qi can also be weakened, and this will be apparent when a person has a weak voice and a disinclination to talk. They can also have a sunken chest and poor posture, because zong qi is not strong enough to expand and open the thorax. The spleen is supposed to transform the food and beverages that are ingested. If there is spleen qi shu, the spleen will fail to perform these functions adequately. This can be seen when a person has a poor appetite and loose stools. Dizziness can also be seen where there is qi shu. This is because qi and shui are not able to ascend up to the head and nourish the brain. The pulse will be weak because there is not enough qi to drive shui through the vessels. Etiology. Qi shu can arise when the body uses more qi than it is able to produce. This will be because the person places too great a demand on their qi, or they are not able to produce sufficient qi. Qi can be burdened by working too much and too hard, or by being too physically active. For example, by playing too much sport or doing too much fitness training, as well as through excessive sex. Illnesses, both chronic and acute, will strain and weaken qi, because qi is used to combat the shi qi, but also because shi qi can disrupt the production of qi. The lung, spleen, and kidneys are all involved in the production of qi. If one or more of these organs are out of balance, it will affect qi production and thereby the qi levels in the whole body. For a more detailed explanation of the etiology of imbalances in these organs, please see the relevant parts of Section 8 on Zangfu imbalances. Poor production of qi can also be due to the quality and quantity of the food and beverages consumed and poor quality air being breathed in. The person may be born Jingshu, which will negatively affect the quality and quantity of their qi. Jingshu can also arise or be exacerbated if a man has too many ejaculations. Chronic qishu and shuishu conditions will also deplete Jing. Symptoms and signs are mental and physical fatigue, pale face, spontaneous sweating, sweating on light activity, poor appetite, loose stools, weak voice, reluctance to speak, dizziness, pale and swollen tongue, and weak pulse. Thank you for your attention.
Let's discuss depression. Acupuncture points, part 4. Acupuncture points for depression, we have bladder 52. The indications for this point include depression, lack of motivation, lack of drive, and lack of willpower. This point strengthens willpower and determination, which are the mental spiritual phenomena pertaining to the kidneys. It is a very useful point in the treatment of certain types of depression. When the person lacks motivation and drive and lacks the willpower and mental strength to get out of the spiral of depression. Needling this point with reinforcing methods, especially combined with bladder 23, will stimulate the willpower and lift the spirit. Bladder 52 strengthens willpower, drive, determination, the capacity of pursuing one's goal with single-mindedness, spirit of initiative, and steadfastness. This point is used if there is a kidney deficiency in combination with one of the other 4 points affecting the spiritual aspect of yin organs. That is bladder 42, bladder 44, bladder 47, and bladder 49 as a solid mental emotional foundation for the other aspect of the psyche. In particular, for depression, the points are the following combination: bladder 23, bladder 52, bladder 47, to strengthen willpower and drive, and to instill a sense of direction and aim in one's life. This combination is excellent to treat the mental exhaustion, lack of drive, and aimlessness and confusion that are typical of chronic depression. If we analyze the names of the following 5 points, we get the following pattern. Bladder 42 means window, window of poo. Bladder 44 means hall, hall of Shen. Bladder 47 means door, door of Hun. Bladder 49 means about of Yi. Bladder 52 means room, room of Shi. We can detect a pattern as the points corresponds to a house, an image for the site with the mind, Shen, willpower, and intellect corresponding to hall, room, and abode, respectively, and the ethereal soul and corporeal soul corresponding to a door and window, respectively. The images of door and window fit well the nature of the ethereal soul and corporeal soul, which provide movement to the psyche, the former providing the coming and going of the mind, and the latter the entering and exiting of the essence. For this reason, bladder 47 is particularly important in the treatment of depression. Kidney 3 is the source U1 point of the kidney channel. It is the best point to tonify the kidneys. This point is used in depression from kidney deficiency to strengthen the willpower, drive, and initiative. Kidney 9, indication for this point include anxiety, insomnia, palpitation, and manic behavior. Kidney 9 is an excellent point to calm the mind in cases of deep anxiety and mental restlessness deriving from kidney yin deficiency. It also relaxes any tension or feeling of oppression felt in the chest, often with palpitations. Because it tonifies kidney yin, calms the mind, and treats palpitation, this point is particularly indicated in the pattern of heart and kidneys not harmonized. It is the starting point of the yin linking vessel, and its mental emotional effect is largely due to this. The yin linking vessel nourishes heart blood and calms the mind. Thank you for your attention.